You thought COVID was over? The lockdowns, the panic, the masks, the vaccines? It all felt like a chapter in the past. But then, something strange happened. You felt tired, unusually tired. You slept well, but woke up drained. You had a slight cough, maybe a bit of nasal congestion, but your rapid test came back negative. So you brushed it off. Maybe allergies, maybe a common cold. But days passed. The fatigue remained. A foggy sense of unease settled in your body, like something wasn't quite right, but you couldn't put your finger on it. Welcome to 2025. COVID hasn't disappeared. It's just evolved. Quieter, smarter, and more dangerous in ways we never expected. New variants like KP.2 and the so-called FLiRT group have emerged, spreading silently, cleverly dodging immunity, and showing up with symptoms that look almost nothing like the COVID we once knew. No more high fevers. No obvious shortness of breath. It's often not even a positive test. But it could still be COVID. It could still lead to complications. It could still mean months of strange, exhausting symptoms that no one seems able to explain. So what is COVID in 2025? Really? How does it work now? And why is it more insidious than ever? The truth is, SARS-CoV-2, the virus behind COVID, is no longer the same virus we met in 2020, after hundreds of mutations. Newer variants don't just go for the lungs. They target the upper respiratory tract, the nervous system, and most concerning, the vascular system, particularly the endothelium, the inner lining of your blood vessels. You might start with nothing more than a scratchy throat and end up with insomnia, a racing heart, lightheadedness, or persistent anxiety. These aren't typical cold symptoms, and yet they're often misdiagnosed, misunderstood, or ignored. In some cases, people never even test positive. PCR may catch it, but not everyone gets tested. Even more alarming, some people have had multiple infections, and after the latest one, they just don't feel like themselves anymore. Their bodies feel off. Then no one can explain why. So what are the real symptoms of COVID in 2025? The early signs are often subtle. A mild sore throat that lasts longer than it should. A dry cough or nasal stuffiness. Pressure headaches that feel like something's pressing behind. Your eyes are at the back of your neck, an unfamiliar kind of fatigue or muscle aches with no clear cause. Then come the more systemic signs. Dizziness upon standing, irregular heartbeat. Mild breathlessness when lying down. Gastrointestinal issues like nausea, bloating, or diarrhea. In rare cases, there's still sudden loss of taste or smell, though that's less common now. But the real danger lies in how easy it is to dismiss all of this. In labs, you might see mildly elevated liver enzymes, low white blood cell counts, or increased dimer, a marker of microclotting. Chest scans might reveal small patches in the lungs, even if you feel fine. And perhaps most haunting of all, many people feel something is wrong, without ever showing a single classic symptom. So why is this version of COVID so persistent, so confusing, and so hard to treat? The answer lies in your immune system. COVID in 2025 isn't just about viral load. It's about how your body reacts, or fails to react in time. These new variants have evolved to slip past your immune system's front lines. They replicate quickly in the nose and throat, often before the body realizes it's under attack. And once inside, the virus doesn't just infect, it inflames. It disrupts your autonomic nervous system. It creates inflammation in your blood vessels. It triggers microclots. It confuses your hormonal signals and drains your cellular energy, okay? And that's why it can take weeks or months to feel normal again. Even young, healthy adults are experiencing something doctors now call post-COVID dysautonomia. Irregular heart rate, body temperature swings, brain fog, and chronic fatigue. It's not just about the virus. It's about the inflammatory chaos it leaves behind. And yes, you can still get this even after 2 or 3 previous infections. Ignored COVID in 2025 can quietly unravel your health. We now know that as many as 1 in 5 infected people go on to develop long COVID symptoms lasting 3 months or more. These include chronic exhaustion, cognitive issues like memory loss or difficulty concentrating, cardiovascular damage, and even increased risk of stroke or diabetes. Some researchers are warning COVID may accelerate aging, disrupt your circadian rhythm, and raise your risk for future neurodegenerative disease. The tragedy is, many of these patients are misdiagnosed, gaslit, or told it's just stress. But their bodies are telling the truth. And so should medicine. So what can you do? Start with the basics. 3 don'ts. Don't rely on rapid tests alone. Don't ignore strange or persistent symptoms. Don't assume past infection means full immunity. Then 3 do's. Do wear a mask in crowded or poorly ventilated indoor spaces. Do stay up to date with variant-specific boosters and health updates. Do support your body. Sleep enough, eat whole foods, manage stress, and move regularly. And one bonus tip, think ventilation. COVID spreads through the air, so airflow matters more than hand sanitizer in 2025. If you're experiencing acute symptoms, even if you're unsure it's COVID, rest. Fully, not I'll still work from home rest. Actual horizontal rest. Hydrate with electrolytes. Eat anti-inflammatory foods like ginger, garlic, turmeric, and dark berries. Monitor your oxygen levels if possible. And if you're higher risk, ask your doctor about antivirals like Paxlovid. But what if it's been weeks or months and you're still not okay? Then it's time to think long COVID recovery. Start by calming your nervous system. Breath work, warm cold contrast showers, slow walks after meals, and pacing your energy. Support your mitochondria with nutrients like KP.2, magnesium, and alpha-lipoic acid. Consider adaptogens like ashwagandha or rhodiola. But always check with a doctor first. Track your symptoms daily. Advocate for yourself. Find a specialist if you can. And most importantly, believe yourself. You are not imagining this. You are not lazy. You are recovering from a complex, misunderstood post-viral condition. And your body is doing the best it can. The truth is, COVID hasn't gone away. It just changed its mask. But you don't have to be caught off guard. You don't have to settle for vague discomfort, and maybe it's nothing. Your body is speaking. Through the fatigue, the insomnia, the weird new palpitations. Don't wait until it screams. Start listening now, because the sooner you do, the more fully you can heal, the more clearly you can protect your future, and the more power you'll have in a world where the virus may have changed. But your awareness is the best defense you'll ever have.